Sometimes people find the modified clinical test of sensory interaction imbalance, also known as mCTSIB, difficult to understand or difficult to interpret the results from each test condition, but it really isn't. So I'm going to explain you, I think in a simple way, I hope, how to conduct a test and what information we collect from each test condition. The mCTSIB is a static balance assessment, and what we are trying to understand is how balance responds when we manipulate the sensory conditions of the environment. And this is because we want to understand if there's any system that is not working properly, or if the person is not using the information provided from a specific system in a proper way, and if it's compensating with information provided from other systems. And so we have 4 test conditions. The first test condition, we have the patient standing on a stable surface. So here we are talking about standing on top of the platform with the eyes open. So here we know that every sensory system is available, so that no information is compromised or decreased. On the second condition, we are going to maintain the stable surface, but we are going to ask the patient to close the eyes. And here we are removing the visual information. So we are left with the information coming from the proprioceptive system and the vestibular system. On the third condition, we are going to add a foam pad, and this is going to make the surface unstable. And so what we are doing is that we are compromising the proprioceptive information coming from the proprioceptive system. And we are relying only on the vestibular system and on the visual information to maintain a good balance response. And the last condition, the fourth condition, we maintain the foam pad, so we are having the patient on top of an unstable surface, and we ask the patient to close his eyes. And here, the only system that is not compromised is the vestibular system. So when we are assessing patients that look like they might have a vestibular dysfunction, we are going to look into the results of this fourth condition. And here on the third, sometimes you can also understand if there's any surface dependency. So what we have here is the results of a real patient. So this is the statokinesiograms that represent the center of pressure displacement, like looking down into the platform. And we see that there's this ellipse that it's formed at the end of the test. And this is a traditional posturography parameter. What it means is that if we have a larger ellipse, it means a higher body sway. It means that the patient was less stable during this test condition. So by looking into each condition, we can understand that, for example, in this case, on the first and on the second condition, the patient was very stable. And this means that he was using the proprioceptive information a lot to maintain balance. When we had the foam pad, his body sway significantly increased, and on the fourth, this is even more noticeable. So we are talking here, we are talking about a patient that is 84 years old, and he has a bilateral vestibular hypofunction. But this is a very simple way to look into the stability level of this patient and assess what conditions are more challenging for him.